I'm just curious as to what my panel has heard about the health care bill, and if you think the president is doing a good job telling you what it's about.
Well, as far as the president telling me about it, I mean, he's been saying a lot about trying to get this health care bill out, but he hasn't been very specific with it, I feel. You know, they haven't really got it or broken it down so that the people can understand, because I am one of the regular people, and I want a little bit more knowledge about it. I want to understand what exactly is going to go with this health care bill. How are you going to help the people? Are you going to make health care a lot more affordable? Seeing as how, you know, bankruptcy with people, one of the largest reasons is health care bills. You know, people can't afford the bills that are coming down. Me as a college student, I know I have issues because I'm trying to get on my mother's health care. And when you're grown, I'm 20 years old now, so I can't be with mommy anymore. I have to get my own health care and provide for myself. So I want to know, are you helping me? Am I going to be able to afford this health care that you're going to provide? Is the government, you know, working for the lower class people?
Yeah, and we've been concentrating quite a bit on some of the town hall meetings and the disruptions that have gone on during the town hall meetings in the media. And I was curious as to whether or not you think that there's a shift, there should be a shift in what we concentrate on and what we can tell the public.
I guess in terms of the health bill, I think in terms of principle, you know, I think it's a solid principle of everyone receiving health care. But I think we got to be very careful in terms of the response by the media, because this is really, it's very political. So even if you listen to the media, they're saying a lot of stuff about Obama being Antichrist. They're making it a very religious issue. They're saying that, you know what, what are you going to say to your God at the end of the day, because you're passing this health bill that's going to, they're trying to scare people by saying, you know what, it's going to kill grandma. So now you got Palin saying that. So what the Republicans are trying to do, and they've invested millions of dollars in a campaign to kind of like make it look as though Obama is doing something wrong. He's going to give health care to all these illegal aliens. You're going to have all these people who are not working, getting free benefits and getting health care. So they're really trying to make them look bad in the media, because they're also trying to prepare themselves for the next election. So I think we got to be very careful about how we look at this health bill.
Well, let's talk about that. Do you think that health care is a moral obligation on the part of the government, or do you think it's a right or a moral obligation?
I think you have to look at it on both sides, as far as it being a moral obligation or something that people should have a right or pay for, because it's like people do need their health care. If you look at other countries like Cuba, or you look at Canada, who offer, you know, health care for their people, and they offer good health care where they can get it at an affordable rate. I think they even do it for free, you know. But here in America, you have people who are going to hospital and be dying because they can't afford the medical care from these different hospitals. I think that the government should step in. You know, they've stepped in with different corporations. They stepped in with the banks and set regulations and different things like that. Why don't they step in on these different hospitals? You know, I think that right there is more important than them stepping in with Chase or stepping in with the different AIGs and bailing them out. Why not bail out the regular people? We need help with this health care, because you have a lot of people out there who can't take care of their kids. You got in the projects where there's a lot of, you know, poverty and roaches and rats and different things like that. You know, roaches they help with asthma. Like, they cause asthma even worse than what it already is. So it's like, there's a lot of people in these impoverished neighborhoods that don't have the proper health care, and they can't take their babies there. So these people who have things like eczema or asthma or different everyday needs, they can't get it because they don't have the proper health care. And I think that that's something that the government should step in and make it so that the people in the lower and the middle class are able to afford.
And that's one of the problems that we have with the existing situation. I mean, not only are there a lot of people without health care because they can't afford it and they're using emergency rooms as their doctors, but we also have a lot of people who are paying into the health care system, and then once they get seriously ill, the insurance companies don't want to pay up. So we have that situation as well as individuals who lose their jobs. And once you lose your job and you're on COBRA, continuing benefits for a certain period of time with your job, but once that period's up and your insurance shoots up to $800 a month, how many people have the money to afford things like that? So we have various components that make health care reform very necessary, but we also have some issues whether or not it's political or if it's a moral right. Claressa, what do you think?
I definitely think that it's a moral right, because when I think about healthcare, I always separate it from like lower class, middle class, and higher class. people that are in like the higher class community would not be able, well, people in the lower class community cannot afford the same things that people in the higher class community can afford. So definitely I think it's a moral obligation for the government to step into, you know, step into these, like, people like us, like people who are like college students like Marquise and myself. I'm in the point where I'm transitioning from, you know, trying to get my own insurance to, you know, stepping out of my mother's insurance. So what am I to do? Like there are thousands of college students around with no health insurance, and we get sick, you know, practically every day or every other week. So I definitely think it's a moral obligation, because there's so many people without health care, and there's so many people that cannot afford it. So it has to be a moral obligation, in my opinion.
And some of the major issues is exactly what Marquise mentioned, whether or not the government should be allowed to step in, because insurance companies are for profit and they're trying to make as much money as they can. So now we have the issue as to whether or not, if the government comes in, whether or not it'll balance the playing field and allow insurance to be cheaper, insurance to be more affordable, and be more widespread. So we really need to actually examine the components of the health care bill.